Why patients have to wait so long to be seen at Princess Margaret Hospital? Why does it
That's a
take
very
so?
good
What?
question. And
Why?
I am one of your weekly guests, Dr. Kent Bazard. I will be filling in this Sunday for Dyson Knight. So it's going to be myself, JP, and of course, we're going to have our special guest, my good friend, good buddy and pal, Dr. Nadia Gilbert. Today we're going to be talking about the public healthcare system in the Bahamas, and more specifically, we're going to really target some of the challenges that are faced at the Princess Margaret Hospital. If you don't know, for those of you that don't live in the Bahamas, the Princess Margaret Hospital is the main tertiary healthcare facility in the Bahamas. The reputation isn't great at Princess Margaret. Customer satisfaction, if they did a survey, I'm pretty sure would be pretty low. Recently, there was a very popular story in the news that made the front page of the papers where a mother essentially made a Facebook video about her experience. And unfortunately, she passed away soon after. That being such a serious situation, it got a lot of attention, got a lot of following. We always try to stay current on the show. I wanted us to tackle this topic this week. You know, I've worked at Princess Margaret in some capacity, firstly as a medical student. When you go to medical school in the system here in the Caribbean, you do your preclinical phase and then you have your clinical phase. Once you do that, we have the option, us Bahamians have the options of doing our clinical phase here in the Bahamas. Let me bring in JP Knowles real quick.
What's up, everybody?
I was talking about how the system works, the public healthcare system, or at least not the physician experience in the Caribbean for Bahamians. Especially if you go to the University of the West Indies. So you do your basic medicine, your preclinical phase, you do outside of the Bahamas. As a matter of fact, some persons actually do it outside of the University of the West Indies system.
Yeah.
Then they come back to Nassau for the clinical phase. And I came back to Nassau for my clinical phase in 2005. Public healthcare system from 2005 to 2022. To 2022. That's a decent time.
Yeah.
And I've seen a lot, done a lot, had a lot of experience, and to be quite honest, experiences. And to be quite honest, I wouldn't trade it for the world. I learned a lot, and I learned from great physicians at the Princess Margaret Hospital. We have some of the best medical doctors, surgeons, anesthesiologists, ONG, some ONG legends, obstetrics and gynecology legends. We have a high-level, highly skilled pediatric team at the Princess Margaret Hospital. And of course, my old home, the radiology department. We just had a new influx of brand new Bahamian radiologists come in. We've been taught by, we've had a lot of experience teaching. I learned how to be tough.
Yeah.
Learn to be tough. It's not an easy road. It's not easy anywhere, but especially because the Caribbean system, the UE system is based on old tradition, old, working 48 hours straight and stuff like that. So a lot of things, a lot of things like that aren't even illegal. It's not even in some parts of the Caribbean anymore. Definitely not in the States. Not illegal anymore. It's illegal now to have doctors work so many hours, those kind of hours. So that's some old school stuff. Your seniors talking to you like trash, trying to make you feel dumb. But the truth is,
I mean, in my opinion, man, all it could do is get you prepared for the actual real world.
Exactly.
No one ever said it's going to be easy. So, and in my opinion, when you go through tough times and tough situations, that's when you really begin to appreciate it when it all comes through in the end. Like you're saying right now.
I got to tell you, you had an experience, JP, in the hospital in the States recently.
Yeah.
And this is during the COVID time. This was during the height of COVID, yeah?
Mm-hmm.
It may be hard to really answer this question, but living over there as a Bahamian, what do you think, and being and having that experience? Because I know you had your kids, so you went through that experience with childbirth and going to doctors, doing your wife's pregnancy and all of that stuff.
Yeah.
Even though you didn't do it in both places. But what do you feel the experience might be different over there? Why some people,
Well,
probably don't. Yeah. What do you think? What do you think is the main differences?
to be honest with you, bro, I could take this all the way back to when I was a kid, when I used to go to a pediatric center called the Heidecker. You familiar with that?
Heidecker?
Heidecker in Centerville. Yeah, in the Bahamas. My doctor's name, and I remember this to this day, was Dr. Ahmed.
Okay.
I remember this. Yeah, man, I remember this because when I was a little kid, I had to have my adenoids removed. You know what adenoids is, right? Right?
Yeah.
So I actually, and that's a long time ago, I had to be at least, I want to say, anywhere between the ages of, 4 to say 6. And I remember the whole process, bro. I remember that like it was yesterday. I remember, when I actually had the operation done, the minor operation done, I had to stay overnight, a few days actually, in the clinic there. I was terrified as a kid, bro, just being there by myself. But I remember Dr. Ahmed has to be dead by now. Notice back then, because back then he had to be literally in his 50s. Back then, when I was 6, and I'm 46 now. Going back to the experiences over here, pretty much you're just a number. And I get it. Everybody can't have that, VIP treatment, so to speak. I get it. But even when you go to the hospital here and you have something major going on with you, you're still not seeing right away.
Right.
I don't care. Listen, I had a kidney stone. I thought I was going to die.
It's interesting you say that. Go ahead.
Okay. I had a kidney stone and try to tough it out. He goes, man, bro, put me on the floor. And I ain't no crybaby type dude, that, whatever. But bro, couldn't take it no more. Had to go to the hospital. And the hospital, JFK, is right here on the corner of my house. So literally 5 minutes down the road. So I got dropped over there, and bro, I'm in excruciating pain, bro, throwing up the works. And these people are supposed to be helping me talking about how they went to the club last night, bro. Bro, it was this lady and this gentleman, right? And they was just laughing how they was drinking and the good times they had. And bro, I losing my mind, bro. I lose, your boy patience very short. I losing my mind. Yeah. The only reason I was put ahead of the line, prior to that kidney stone, a week before that, there was a police officer. We actually did his floors in his home. And he said, hey, this is my buddy, white guy, and walked me to the front of the line and sat me in front of everybody. And I still sat there in emergency or whatever you want to call that. It was like 1 o'clock in the morning. I still sat there, bro, throwing up all over myself like a moron, bro, feeling crazy. And when I actually got in to see the doctor, when they came in to do the whole blood, test, whatever, bro, it's like grabbing a broom and just shoving it in my arm, bro. They stick that needle in there so quick. When you hear a needle pop through your skin?
Your police officer friend walk you to the front. So even though you're in the States now, and this is a major city, you're in not Delray, right?
West Palm Beach. West Palm Beach.
West Palm Beach, major city in the United States, and you still had to, first of all, sit there in pain.
Oh yeah.
For quite an amount of time.
Bro, at least an hour and a half.
And I can tell you, I never had it, but I've seen patients with it, so I know that stone don't play. That bring down the biggest man.
Bro, immediately. Only that big, Was that big, bro?
Yeah.
Listen, bro, let me tell you. I don't wish it on nobody. I see a lot of people, over the years, talk a bunch of crap about PMH versus Doctors Hospital and this one against that one. Listen, man, in my opinion, no matter where you go in the world, you're going to meet people that just are like that. Okay? It doesn't necessarily reflect as a whole. You get where I'm coming from? That everybody, you cannot throw everybody in the same bucket because a few bad apples, so to speak. Because trust me, there are many bad apples worldwide. Because I know a lot of Bahamians, they figure like, oh, in America, they don't do it. Oh, yeah, they do. Oh, yeah, they do. Oh, yeah, they do. Trust me when I tell you that. Okay, knock on wood, I've never been to the hospital for nothing major, but I've been to the hospital to see buddies of mine, my kids, through the years, things happen. And almost all the time I was put on the back burner. I gotta wait. And I know a lot of people. I know a lot of people in high positions that can pull favors, the works. But hey, no.
Let me look up something real quick. Average waiting time. Sorry.
Bring her in. She said she's here.
In emergency room in the United States. What's the average waiting time in emergency room in the United States? It used to be a couple hours straight. So the average is 145 minutes, but you have to wait much longer in some states, up to 9 hours.
Oh yeah.
So the average is 145 minutes. That's a roughly little over two hours.
Yeah.
Two and a half hours or so. And then they say the average length is 4 hours in the hospital. But in some states, it's up to 9 hours. Because you're looking at an average. But the point is, so that's the biggest complaint that we get locally is wait time. And, I spoke to somebody earlier today about this. What they said was that a hospital wasn't originally designed to carry the load that it's carrying. Dr. Gilbert.
Hi.
Hello. How are you?
I'm doing well. How are you guys?
We're good.
Very good. Dr. Gilbert, I want you to meet one of my good buddies, best friend. What they said, I learned this word yesterday when I was at the track, bestie.
All saying again amongst the young kids.
This is one of my besties. Mr. Warren knows he's coming to us from not West Palm. Where are you now, bro?
I'm on West Palm now.
West Palm now. He's in West Palm.
True.
And as usual, we get some regular guys talking about regular stuff on a regular Sunday.
I just came from a regular track meet, so I'm sorry about that.
No, man. We know it's going to be worthwhile having you here. So thank you for joining us. We really appreciate your input. So just for some background, we went to medical school together. We graduated together. We both started at Princess Margaret Hospital together. So she's been there a little longer than me since I left. And she's an emergency medicine specialist. She's a postgraduate in emergency medicine from the University of the West Indies. So she got a paper and she knows what she's talking about. And she has experience. She has loads of experience, and she's an excellent physician.
No pressure at all. No pressure.
Little correction. Postgraduate in acute medicine, and I worked in the emergency room for 16 years. So if you want to call that a specialist, I guess same thing. Been there long enough.
You're a specialist, and you're an expert on the emergency room at Princess Margaret Hospital, for sure.
Definitely.
Mind you, they keep correcting me. I started my emergency life at doctors, so I keep saying emergency room, but Princess Margaret Hospital is say A&E, so you got to say accident and emergency. I'm sorry.
Accident and emergency department.
Accident and emergency department at Princess Margaret Hospital. Sorry, guys. Correct. I'm very sorry.
Come on, get it right.
So Nadia, we can come out. We just come out. You come from the track meet. We coming out the blocks. All right.
Okay.
What are the challenges? Okay, why patients have to wait so long to be seen at Princess Margaret Hospital?
That's a very good question. And
why?
I can answer that so many ways. Well, Well, like you guys were just going over average wait time. There was a time when we did get it down to average waiting time being 4 hours, and then it went up to 8 hours, and then COVID came, and then what you were seeing within 30 minutes, because only the emergency cases were coming in at that time. Right. And then as you know, things started opening back up and everything, it went back again to long waiting times. There's lots of constraints that we have in the department itself, whether it be lack of staff, whether it be lack of equipment, and it's a lot of patients actually come in. One of the things that we have tried to do over the years is triage the patients properly, where triaging is an international thing where you have to sort the patients out, right? Mm-hmm. So the main aim is to sort the patients out and get them to the right place at the right time. That's really what triaging is about. Number, I would say, I don't want to say number one, but a main problem that we have in the hospital is, unfortunately, we have a lot of patients that really don't need to be there. That's why one of the good things about triaging is, and it has brought it out at the front door of the hospital, is we try to solve a lot of the problems right at the block, like you said, at the door, so that you don't have to get in the back. Unfortunately, even though we've done that to try and streamline the patients that don't really need to be in hospital, some days we're just inundated with the amount of patients. Right. We can see over 200 to 300 patients in a given day. In a week, we see over 2,000 patients, and we have a lot of repeat offenders. I think one of the main problems is that it hasn't been emphasized enough what the hospital's job really is. You know, in medical school, we've been taught what is primary, what is secondary, and what is tertiary care. The primary care is the first line doctor that you meet, and that's the doctor that you should meet, provided you go to the clinics. And the government has instituted NHI, something free for the Bahamian public at large to use. And even though it has helped, it still hasn't solved the problem, because Bahamians still believe, I'm going to the hospital, it's a one-stop shop, and that's where I can get what I need done one time. Right. And even though we try to curtail that, we're still sometimes overwhelmed with the amount of patients who can be seen in clinic. And so at any given time, we can have 30 patients in the emergency room, and out of those 30, I'll give you 10 of them, apart from the gunshots and the stabbings that are coming in, about 10 of them really should be there. But you still have another 20 who come for reasons that they can be dealt with in the clinic. And that adds to the long waiting time. And so until we continue to push that effort, you know, there's only so much we can do. I have a few friends who have gone to do post-grad training in South Africa, and they've told me that nobody comes to the hospital unless they have a paper from the doctor, from a clinic, saying that you've actually been to see the doctor, and the doctor says you have to come to the hospital. We have a few patients that do go to the doctor, and the doctor sends them in, but the majority of them, they just come for a one-stop shop, and they treat the hospital as if it's a clinic. And when we get overwhelmed and inundated with patients that don't really be there, I mean, what are we really supposed to do? We don't turn anybody away. Right.
Yes. So another issue. So I want to stick with the front door for a second, because that's still the triage and pre-triage point. Because I look at the whole process as a flow, right? And we had this conversation a dozen times or more, Nadia. But so what I try to do is look at what I've tried to do while I was there, just observing from the outside, because I didn't work in A&E. I worked in radiology. So, but radiology is directly connected to A&E and everybody else. But I always try to see what is the bottleneck, because they're like, what is the bottleneck? And there are multiple bottlenecks, right? So the first one, there are bottlenecks, and then there are, what's the word? I don't want to say restrictions, but maybe you say handicaps, right? Mm-hmm. So there's some things that we don't have enough of. So handicaps are deficits, and there's the bottlenecks.
When you say there are things that we don't have enough of, when you think about it, unfortunately, that goes down to financing.
Yeah.
Everybody believes that when you come to PMH, it's free.
Yes.
Healthcare nowhere in the world is free. No. However, that is the mindset. Okay.
Yeah.
They go to the other hospitals. The other hospitals demand what it is that you have to pay before you see the physician. They don't care how urgent it is, how emergent it is. You have to pay something.
Yeah.
Okay. And so we are bottlenecked from the entrance.
Right.
Everybody comes to hospital and we only ask for $10. I always say from
you enter
PMH, you should be paying us a minimum, and that's just lightly, a minimum of $200, okay? For all from x-rays, blood works. One blood test alone costs $200, and we run slews of blood tests on patients every day. Right. You have urine, you have CT. CT alone is what, Ken? $500?
$500.
Or how much is CT at PMH? I mean, at PMH.
Oh yeah, CT brain is like $200.
Oh, so it's $200 at PMH.
It's not that much.
And we run CTs as if what we just asked. We're giving away candy.
That's not the cost. That's not the cost. Okay. That's what we charge.
That's what we charge, exactly. At our institution.
The cost is about $900 to $1,200. That's the cost.
Easily.
So every time we run it, we lose money every time we run it.
Right. And they don't even pay that. And it's like, you're supposed to do what you're supposed to do, which is what we do, because we are there to save lives. And so you end up with a bottleneck right from the start, because you have patients coming in that don't pay, and the hospital is supposed to be a continuous care going on. And so how are we supposed to have beds? How are we supposed to have medication? How are we supposed to have wheelchairs to take the patients when they pull up at the front of the hospitals to take them in the back? How are we supposed to have something as simple as Band-Aid, needles, syringes? These things, sometimes we have limited amount of stuff to use, but we make do with what we have and we make it work.
Right.
But the public doesn't see that. They don't know that we make it work. But, you know, financing is a big issue.
Well, let me ask you this, right, if I may. What about, and I already know, because my background, I'm from Nassau, Canberra. So, you know, but I've been here in the States now for like going on 20 years, but I'm familiar with PMH, Doctors Hospital, and everything else. What about when you deal with those people that's just hard to deal with, attitude-wise? Because I mean, you know, from when I was a child, I'm now 46. When I was a child, in the Bahamas, in PMH, I could remember going there to get different things done for me as a child or family member, and I could almost remember almost every single time there were one or two people that was just so difficult to deal with, as far as a sense of understanding, a sense of process that has to go through before we even can get to what you really need.
Yes. And
so how can we deal with something like that?
That is a daily challenge. You know, we're expected to just sit there and smile.
Yeah.
You know, and no matter how many times we hold our breath, we take a woo-saw moment, and we explain.
Yeah.
I mean, we have top-notch physicians. Okay, when our physicians leave the country and they go off to the States, they usually head their departments.
Absolutely.
Okay, so I don't want people to think that oh, these are fly by night persons. No, these are well trained, world class physicians that you have at PMH, and for whatever reason, the public still think that we're just Mickey Mouse operators. I don't know. Many times we say this is not a fast food institution. You can't just roll in and roll back out. That's what the clinic is for.
Yeah.
But that's still not understood.
Yeah. I mean, just to add to what you're saying, I would say too that we also have world class nursing.
Oh, definitely.
And again,
many times I've been saved by my nurses. Many times.
Man, our nurses can run circles around a lot of nurses from a lot of other countries. Like they run circles around some physicians from other countries.
Definitely.
So I'm saying, so the question to that same point, and the answer is kind of obvious, but if we can excel so great in that other environment, then we need to fix the environment, I assume. So something is in that environment that needs to be adjusted, and that's some of the things you want to get to. So we originally talk about the fact that there's no money coming in at the front door. So we know, and Dr. Sands made a big thing about this. You guys hear me? Okay. So you guys, Dr. Sands made a big thing about this when he was minister. That was one of the first things he tackled. And I think it's the first time he looked at the numbers and he probably saw how the hospital operates and said, nah, this is crazy. You know what I mean? Because that's what it seems like. It seems like he had an aha moment and he saw some numbers and he said, no way, the hospital can't operate like this. We're operating at millions of dollars of loss. So we need to try to turn that around. And it seemed like that was his agenda at first. So it sounds like what you're suggesting, Nadia, is a good idea, because from everything else has gone up in price. I mean,
everything.
I thought it was $15. He said it's $10. And I know, because I've heard people argue about that $10. Like they don't even want to pay the $10.
Oh,
no.
Shit.
But then these are the people who getting ready to go away on a flight to shop in Miami, Fort Lauderdale, Orlando, spend hundreds of dollars, and we can't even get the $10.
Guys, you know what? In my opinion, the hospital sounds fine to me. This is the mindset of the people.
But
well,
Lauren, we can't.
How are we going to change that?
Listen, Nadia, right?
Correct.
Right. That's one of the aim of this show, actually. Like we're on what episode is this now? 17?
Yeah.
Episode 17. And trust me, if you go back in the backlog, we have some serious topics dealing with the mindset of just people in general. Because, like I said, I can remember, the whole stigma of Doctors Hospital versus PMH. Like, these people don't act this way in doctors. No. They do.
Because they pay in their money. And when you pay your money, you expect to get a certain level of service. When you don't pay your money, you expect, at PMH, they don't pay any money, but they still expecting a certain level of service. Mm-hmm. And they say they want you to show you care, which if we didn't care, we wouldn't be there.
Exactly.
We're not getting the money in the first place.
Exactly.
So you have to be dedicated to be there and come out of your bed and leave your families. I have a nursing friend, her husband works in one of the surgical departments, and some days she doesn't see him, or as soon as she gets in the door, he is out of the door, or he's not coming home till 3 o'clock in the morning. So really, what are you talking about?
Yeah.
And you say that we're not dedicated, but then we're still expected to have a smile on our face and deal with the attitudes of the patients, and not really so much the patients all the time. It's really their relatives. The relatives really make it horrible for the patient that is sick. And then we're expected to just sit there and take the harassment, the verbal abuse, and daily, and we shouldn't call security on you. We have to think of for our own safety.
Your own safety,
Many days we've been threatened. Many days we have to look over our shoulder to see if somebody is in the parking lot waiting for us. Okay? And yet the public still wants us to take the abuse and still smile and say we care and still function normally and still take care of you. Like,
so here's what I can tell you. Here's what the people will say. People will say that that's our job. People will say as a health professional, that's what we're supposed to do, is tolerate the abuse and things like that. As a matter of fact, they would say something like, they would probably say, because you're being paid so well, and because we're doctors, we should be okay with taking that abuse anyway, because we're rich. I lie that in. Am I lying?
That's the perception. The perception is that we're rich, but that's not the case.
Right. So again, you should take this abuse because you work, they working for you. You working for them. In any event.
Yeah, many times I've heard the phrase that I paid for you to go to school. I paid tax dollars, and I tell them, no, I was not on the government grant to go to UWI.
Yeah, tax dollars
paid for me. So you ain't talking to me. I don't know who you're talking to. You're talking to somebody else because you ain't paid for me. So don't come at me with that attitude in the first place. Because you have to stand up for yourself. They don't go in the U.S. Embassy and have that attitude.
No, they do not.
They don't go in doctor's hospital and have that attitude.
No, they do not.
They don't go anywhere where there's some type of. They don't go in the bank with that attitude. So why should you have that attitude in Princess Margaret Hospital?
Because Princess Margaret is seen as Bahamian owned, and we all know Bahamians don't support Bahamians. But okay, I'm back on it again. Back on my bullshit again. Bahamians don't support Bahamians. Doctors Hospital.
I would tie on to that and this.
Let me finish. Hold on. Let me finish my point. Because I have my mind all over the place. Doctors Hospital is seen as the foreign, better hospital.
Okay.
So how dare we go there and act up? That's Americans. That's saying elsewhere. The whole movie scene that that people see, they think that's the image. Bro, that's the truth. That's the image they get.
But you can present that image when you're getting the money.
Yep. Absolutely.
Trust me, if PMH was to get that kind of money, that image would change.
There was a young man, another group I'm in on WhatsApp. There was a young man there was a gentleman that forwarded a video in the group, and there was this other young guy, looked to be no more than 25, rapping, and he was going in on PMH, saying people just go there to die, and they killing you, and blah, 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 blah. And I made a comment. I was like, number one, he get a 0 out of 10 for the rap skills because he was trash. That's number one. Number two, it's like, bro, like me and Kent discuss all the time. Anywhere you go, you have bad apples in a batch.
Anyway,
it doesn't necessarily condemn the whole entire bunch. And he looked to be no more than 24 anyway. So what the hell, What are you even talking about?
They're the main ones that are coming in for the gunshot wounds and the stabbings and everything else. I thought of a scenario as to why sometimes. And this can happen at any given day, okay? Why the waiting times are even extended. I recall a shift where there was a party happening somewhere, and 5 individuals came in with gunshots.
Wow.
Okay?
All at once.
All at once. And trauma room, which is the most critical area, was already full. With at least 4. Trauma room can ideally support 4 patients. We can to 9 patients in trauma room if you are really, really ill at one time. Okay. And trauma room already had about 5 patients. And we had 5 gunshots coming at the same time. And so our job is to deal with the most emergent patient at that time. And so when we have, at that point, we need all staff on deck, all nurses, all doctors to deal with those patients at that point in time. So that's going to hold up waiting time for patients that are there just for regular checkup stuff, or who has a chest pain, or who has abdominal pain, or who comes in with some kind of bleeding, because your vitals are showing that you're not as critical. Yes, you're in pain, and we understand that we need to get to you, but we need to deal with those persons first, you know. And so that is priority. So you can imagine we have 3 shifts in the emergency room, and you can have that kind of scenario at any time of the day, from morning straight to the midnight shift. Wow. And they wonder why the waiting time is so long.
Right.
So
you know,
the first thing you said, Nadia, was staff. And honestly, I had that further down on the list. But you said staff. So do you think that if we were to, let's say we had 5 triage stations up front, 3 to 5, do you think that would move things along faster? Like, is that one of the things we can look at? Can we look at, definitely, we know we need more physicians and nurses. We know that already. And I think we're correcting this right now, but we need an improved workspace. But I think we're working on that, and we're getting there.
That's going to take some time.
That's going to take time. But do you think that if we increase, say for now, if we increase the ability to triage more patients at once, do you think that would shorten the time a little bit?
It can. Every day is not the same. It can help. During COVID time, we had like at least 3 triaging areas. And it can shorten time to a certain aspect. But again, when you have those critical gunshots, or somebody just pull up, they're unresponsive, or somebody pull up and they're not breathing, or this person just got shot, it's still going to cause a bottleneck effect in the end.
Right.
But it helps. But then again, you're still dealing with staff that are very, very overworked and tired, but they're still dedicated, and they still come out to serve the Bahamian public every day, every shift on a daily basis. And we're not expected to get tired. I have acid reflux, okay? And I'm only one person with acid reflux, because many days we don't eat.
Yeah.
Wow.
We're supposed to get lunch breaks. We're supposed to get regular breaks, but we don't have time to do that because we have so many patients to be seeing. If I get a chance to eat, I hurry up, go and I eat, 5-10 minutes, and I'm right back out to see the patient. Yeah. So to say,
it's like you taking on a bullet and eating the burger at the same time.
Exactly. But you got to do what you got to do to get right
I
back.
always said, you know, being a physician, especially at PMH, is probably the most unhealthiest job on this island, in this country. It's very unhealthy because you do ridiculous hours. We take stuff to stay up. We take stuff to go to sleep. When we do eat, we eat terribly. You know, my go-to meal used to be BAHA shot at 3 o'clock in the morning. Like that was my go-to meal. You know?
That's heavy. That's heavy. 3 o'clock in the morning. That's heavy, boy.
What else do you eat when you're starving? There's nothing else. There's nothing else to eat at 3 o'clock. There's nothing else. So you gotta. Well, Imperial was a little closer, so we still swing to Imperial real quick.
The go-to now is the pun is Esso Tucky. Oh. So that's a go-to place on the run.
Yeah, that chicken wing.
You know, on the run, that chicken and fries, and they're always open 24 hours, so they call it Esso Tucky.
So getting back to staff. So let's touch on so definitely more staff. We're working on the space, so we expect some improvement there. Do you know how many, like what the trauma room will look like in the new emergency room, in the new
I've seen
accident
in the layout, but I can't recall how many patients it's supposed to house at one time. I don't remember. what the full layout is supposed to be. It's supposed to be something pretty nifty and pretty dandy. I don't know how we're going to maintain it, but it's supposed to be top notch. I know a lot of people say from they enter the new section by the critical care area, it kind of reminds them of the Cleveland Clinic is what I've heard. I've never been to Cleveland Clinic to say that it's actually so. So I expect it to look somewhere with along that lines, but that is going to take at least another 2 years.
Really? Wow, I thought they were close. I thought they were close.
No, that's still going to take a little while. It's a lot to be done.
Wow.
To get that where it needs to be.
So that leads me to another point, which is, and I think, I don't want to call his name, but a senior physician. I had this discussion with a senior physician before, and I think he's right. You may know this physician, Nadia. He wrote a book on Princess Margaret Hospital. He actually produced a book on the history of Princess Margaret Hospital. That physician, and what he told me was, you know, this hospital, even though it's supposed to be tertiary care, back then when it was built, tertiary care is much larger, much faster, and made to move a lot more patients than it did before. So the patient load increased, but nothing else increased really about the structure itself that's supposed to manage the patient load. You know what I mean? So you're still
go on.
Yeah, you're squeezing this patient load through this process, and it's the load is getting bigger and bigger, but the way you're trying to fit them into is not getting bigger.
No. I mean, we're a very sick nation. Okay. Yes. Right down to our diet, all the fast food places. And they always say common things are common. Well, we are hypertension, diabetes, and stroke specialists at Margaret Hospital. And one thing leads to the other, and hypertension is preventable and diabetes is preventable to some point. At least type 2 diabetes is. Type 1 is of a different process. But type 2 diabetes and all of those lead to what? Stroke, heart attack, losing limbs, losing your eyesight, things that can be prevented, heart failure, that kind of thing. But our public, like you said, the cost of living has gone up, so the public can't really afford to eat properly. Then they say they can't afford the medication, but we provided the government the drug plan to help. We're still overwhelmed with the patients, so we're just going to be at a loss always.
But there's one thing that's free, though.
Pardon?
There's one thing that's always free.
What's that?
Exercise.
Definitely so.
What is
Definitely,
that? Is that something? I'm not a doctor. Is that something that can, I wouldn't say prevent some of those issues from occurring, but cut down on it? Yes. If people would just take care of themselves?
Yes, and Kent brought out a good example of that previously, that a lot of people come to PMH looking for a cure.
Absolutely.
That's not the place to look for a cure.
Me and Kent are gym nuts. We stay in the gym. So we in another group we're in on WhatsApp, we preach all the time. You know, there's a lot of things that you can't, do. There's a lot of things that's beyond your control. But one thing that is totally in your control, that's your weight.
Weight.
And some people, I understand, it's hard.
Yeah.
It is. It's hard. So it's not like we just throwing those people under the bus that can't get that mindset together. But my whole thing is, if you see these things happening around you, We have professionals that's telling you hypertension, it's a silent killer. You know, all these things that could potentially cut your life short. Now, when you got to go, you got to go, no matter what you do. We all understand that. Okay. But we're talking about prevention measures that could at least prolong your life somewhat longer if you just would do a few adjusted things in your life. The thing is, with a lot of people, in my experience, a lot of people don't want to put in the time and effort to do anything. And people like, people go to the hospital when they're ready to die.
Yeah.
A lot of these symptoms and stuff that you know about, you feel it is in your, you inherit in the family, all that. If you would just see the doctor on a regular basis, a lot of these things would be prevented. And like you say, when they come to the hospital now, they're expecting a miracle when it's so long gone. There's only so much you could do.
Yeah.
And then when you don't perform your miracle like Lord Jesus Christ himself, that's when you get a bad rep.
And that's in most cases.
Wow.
And like Nadia said, and this is not only in accident and emergency, but all over the hospital, the operating theater, the O&G department, in pediatrics and medicine, we perform miracles every day, all day.
Every day.
Like miracles at that hospital is just regular work.
Yeah.
You understand what I'm saying? But whenever, and I'm not making excuses, but because if you screw up, you screw up. Let's just call a spade a spade. If you screw it up, you screw it up. And there are many ways that the hospital, from the admin down to the person who's sweeping the floor, can improve, right? But what I'm saying is, we only hear about the one. And granted, nobody wants that one, or nobody wants that few issues to happen. But what I'm saying is, what you never hear about is the miracles that is performed in that hospital every single day, all day.
All day.
And that's by all the staff. You got. I mentioned a few weeks back when I was when I was being interviewed, I was talking about the porters, man. Don't forget about the porters.
Oh, definitely not.
Please, dude, those guys, like, they skateboarding the patients, man. It's crazy. All right.
They have a lot of back trouble from pushing around 300 or 500-pound patients.
I'm telling you, man, the porters got to run stuff up and down. The phlebotomists, the technicians, the radiology technicians, the ultrasound technicians, the ECG technicians, these guys, sometimes at night is one of them, right? One.
To service the whole hospital.
One.
Wow.
So you can imagine an emergency on the ward, an emergency in trauma room, an emergency in gynae, right? And they get there, but these people are still not appreciated for the job that they do.
Yeah, it's not easy, and I think I'm leaning towards your first answer, Nadia. I think staff is a big thing, and that trickles back to money and as far as revenue. And I don't even know if it's being considered to run the hospital like something that needs to collect revenue. Because again, like I said, we've done all types of high-level surgery. Look, let me give you an example. I use this example a lot. Let's just say one of our Bahamian male counterparts decide to jump on his Suzuki or his Kawasaki 6 and go down the middle of the road on Prince Charles with holding the bar sideways like this, right? He decides to run into a car. You know what I'm talking about?
Yeah.
Right? And he decides to hit the back of somebody's car, or somebody pull up in front of him, whatever.
So you decide.
Right. Anyway, long story short, he ends up in the emergency room. Okay, so this guy has to be, first of all, it's ambulance transport, right? He has to be seen.
And off the top, that's a whole nother kettle of fish, because
Yeah,
from
we
the
didn't even talk about
moment
that.
you get into that ambulance, you need to be paying them again a minimum
Oh,
of
boy.
$200.
Yes.
And they tell you they ain't get no money because they believe that the ambulance service is free.
Right.
People call just to carry them to clinic. And the public wonders why they can't get through.
Right.
Relative needs the ambulance, and people call for the craziest things. You'd be surprised.
Yeah.
So that's a whole nother, that's a whole
Well,
patient is brought in by ambulance.
Yeah, I didn't even mention that, but patient transport is a whole topic in itself. There's patient transport inside the hospital and patient transport outside the hospital, and all of that is usually headed up as it's run as its own company, like its own business, because that in itself is a lot of stuff to manage. The ambulance really shouldn't be doing ordinary, or at least an on-call ambulance shouldn't be doing regular transport. But unfortunately, again, because of numbers, we have to use what we have. So a lot of times an ambulance is doing transport. Don't let the CT machine be down.
Oh.
But if the ambulance is doing a transport and then a call comes in, they can't just drop that person and run to, you know what I'm saying? So they still have to see that person to where they are, make sure that they're okay. They can't just throw them out the ambulance either.
No.
You know what I mean? They have to make sure that patient is dropped off and hurry up and get to the accident scene where this motorbike guy has been laying for the past hour or 2 hours.
Exactly.
Wow.
And then they gotta try not to get shot from his boys then who say, why y'all taking so long?
Right. Don't you see a guy dying? What y'all dealing with?
Right. So if they try to,
they're safe while they're trying to stabilize the patient, and these guys ready to come at them with whatever cutlass, gun, whatever they have on them, because this their boy, and we need to be saving their boy life, and we don't care.
Right. So what really the end of my story is, after this guy sees a doctor, get all his blood tests, has to have maybe a bunch of imaging done, has to have seen by orthopedics, gets an orthopedic surgery, maybe has a revision surgery, more blood tests done, more imaging done. His bill is going to be in the six figures, somewhere around $200,000 or more dollars. And how much of that do you think the hospital collects?
Not even the $10 to come inside.
Not even the $10.
Because
not even the $10.
Wow.
No, so when you have a system, when you have it, and I'm not coming down on the motorbike guys, the bikers, but I'm just saying.
Daily, hourly, second, minutes basis. Okay. And that's one patient.
That's one patient and one. You go on the orthopedic ward and just say, how much you all in here for ambulance for a motorbike accident? You see hands go. You see bunch of hands go. No, I'm not.
Hey, because they decide to run up in the back of a car.
I'm trying to make fun.
Oh boy, I tell you.
I'm not trying to troll these guys, but I'm just saying, there's a heavy load on the hospital from multiple angles, from multiple sides.
We need to cover this topic again.
We need to talk because we ain't talk about public health, you know. We just talk about PMH.
The rabbit hole is crazy deep.
We ain't even talking about public health per se.
No.
We're just talking about PMH. But anyway.
Definitely need a part 2, 3, and 4.
We definitely need a part 2. We need a part 2.
3 and 4, bro. Damn.
But I just wanted to. So, before we close up, I just wanted to, I guess, just say that it's unfortunate that the strain that's put on the system in general and the hub of the system, which is PMH, I think there are a lot of things that we need to work on as a community of people who live here. I can't even say Bahamians no more. People who live here, right? Communication is key. I feel like a lot of patients I come across in my private practice now, and a lot of patients I speak to some of them understand what's going on with them, but a lot of them don't. They don't understand what's going on, and it's not because they weren't explained to per se, but I think many times patients just maybe they feel embarrassed to say they don't understand, or maybe they just forget. Right? So for multiple reasons, the communication sometimes break down, and I think as we kind of alluded to a little bit, we as civilians, we as people, have to take our own health and safety, Mr. Motorbike Person, into accountability. We have to be accountable for our own health. We have to be accountable for our own safety, and we have to learn to be accountable for the choices that we make.
Yep.
And this is my last point as we clear out. I'm gonna let Juan speak, and I'm gonna let Nadia close us out because she's the guest. No, but no. Even if you want to just shout out.
No pressure. No pressure. No pressure.
No, even if you just want to shout out the crew, even if you just want to shout us out. But I just really wanted to say that it's really important for those things to work together. For us to be able, for the healthcare system and all of us who work in healthcare, we're not okay. I can't speak for everybody, but all the ones I know are very passionate about what they do. They take it very seriously, and especially with COVID, like we take it very seriously. We came to work not knowing what was going on, not knowing if I'm going to take some disease home to my wife and kids. Like we had no idea what was happening, but you know what? We charged in. These guys faced it head on. We didn't know if the community was going to collapse, or we didn't know what was going on, right? But these are people who, and I'm talking about from the person who's sweeping the floor to the guy sitting up in admin behind the desk and all the doctors and everybody else in between. We are passionate about what we do, and we take healthcare very seriously. So the relationship between the employees and workers and the team at PMH and the public, I think we really need to work on strengthening that relationship. If there's some healing to be done, we need to have some healing done. More communication between both sides so that we can understand what everybody's concerns are and what everybody's challenges are. And I think that's going to lead to a better, first of all, a better PMH, and eventually, I think, a better healthcare system. Mr. Knowles.
All right. As a business owner myself here in West Palm Beach for 15 years now, right? I run my business similar like how a team runs. Everybody has an important role to play, okay? For those roles to happen, for the task to be done in an appropriate and promptly manner, everybody have a role to play. I say that to say this. Doctors have a role to play. Everybody else, administrative staff, everybody has a role to play. As patients, you have a role to play also.
Definitely.
You understand? And most times, you prevent yourself from not being seen on time.
Exactly.
Okay? And that has to change, man. You understand? You can't, first of all, you can't run up in the back of a car, like Ken say, injure yourself or whatever may happen, right? Go to the hospital. Expect these people to push everybody aside that's been before you and just get to you. And then when these things don't happen, you kick up an attitude. The only thing you're doing is delaying the process. That's all you do. And then when the process gets delayed due to your stupidity, you want to point fingers and throw the blame at people. Now, I'm not trying to say some doctors are not as attentive as others, some nurses. Yeah, wherever you go in life in general, that's not designated only to the hospital.
Exactly.
That's designated no matter what. You can go in Walmart And the cash are acting up because you have a bad day, and yeah.
It's just human.
So it's a human nature. But first and foremost, and I've always said this on the show from episode number 1, we as Bahamian people have to change our mindset. You have to change. It starts with you. It starts with you. And if we don't change our mindset, we're going to become a society, a nation of just crazy people. With stuff just going on like what the heck? I mean, don't get me wrong, pull out the crazy when it's time to pull out the crazy. We get that. But you can't pull out the crazy on a doctor when they're actually trying to help you, man. So in closing, everybody has a role to play. You sick, you injured, you hurt, let the doctors do their thing. Let them do their thing. And I'm pretty sure, even if you have the money to be paid, depending on your injuries, you go to the doctor's hospital, you still got to wait.
Still have to wait and don't say
You still have to wait. But we have this mindset like, oh, doctor's hospital, glory. Once I go there, the angels jump out the top window and come down and swoop us up and just escort us in, and you know. And you know what's so funny, Nadia, is that has been the thought pattern since I was a child. It's always been that way. Man, you go to the PMH, boy, don't go over there. You're crazy. You ain't gonna leave. You go to doctors, you be done in 5 minutes.
5 minutes.
Before you came on the show, I was telling Kent I had a kidney stone and I went to JFK. And let me tell you something. The word for JFK over here, the initials, you know, it stands for John F. Kennedy, right? No, the people over here, that stands for just effing kill me. Yeah. Yeah. Because
in the hospital?
here, JFK is considered like the PMH. You have Bethesda Hospital, you have St. Mary's. These are supposed to be the. But guess what? When a nigga got a kidney stone 3 o'clock in the morning, JFK on the corner, I go in there. But like I was telling Ken, listen, when I went there on emergency, I wake up in 1 o'clock in the morning, listen, kidney stone ain't no joke. No. And I'm not a crybaby type dude. I'm a tough dude. I don't cry for nothing. Listen, put me down like a girl. And when I went there, I tell Ken, they had me waiting. There was a gentleman and a young lady. They was talking about how they was drinking in the club the night before. That time I sitting there with water in my eyes, throwing up all over the place. Like, could somebody please pay attention to me? Because I'm about to have a baby. That's how I'm feeling me. Please. So I said I could say this, like people in the Bahamas who think, oh, you know, the Americans do it. No, they don't.
No.
I've been living here for 20-some years, and very few. I haven't visited the hospital a lot, but very few hospitals I go into, I still gotta wait 2-3 hours, throwing up all over myself like a madman. No, actually, I'll kidney stone, make it throw up, but yeah, I've thrown up.
Yeah.
So I said it to say this: please have patience with the doctors, man. They're there to help you. They're there to look after you. Let them do their damn job. That's it. Nadia.
What to say? All I can say is that the staff at PMH, they are all very dedicated persons who love their job. And of course, everybody has a bad day. Unfortunately, sometimes that happens. But for the most part, they care.
Mm-hmm.
They do care. They leave their families for hours. Sometimes you have nurses working 24 hours and haven't been home to see their family, their kids. Same thing with physicians. I remember when I first started out in the medical field, I would not have been home anywhere from 48 to 72 hours.
Wow.
Just in the hospital, taking care of people, doing surgery, still have to wake up and go to clinic. So, you know, the concept of thinking that we don't care, that needs to stop. And I don't know if there's any way that we can educate the public more. Everything now is more social media. So I guess persons don't really watch television as much anymore. Maybe if we can just get the message out, you know, when you really should come to hospital and use your primary care physicians more often to avoid the long waiting times in hospital, because you don't really need to be there. Maybe that's something that needs to be done. We definitely need to work on how we can capture more financing. That's always an issue, and I'm sure it's going to continue to be an issue. But we don't turn anyone away. And by all means, if you have to come, come. And we will let you know if you really should be there or if you can go elsewhere. And we will treat or we will lean you in the right direction.
It's good stuff.
Awesome. Awesome. Good stuff. All right, guys, this has been episode number 17 of the Sup'm Show. This is Dr. Ken Bazard filling in for that guy.
that Dyson Knight singer, we don't even know what group he belonged to but him.
Yeah, this is his show. He's doing some celebrity thing, so he let us run the show tonight. He's doing some high class something. Whatever. Who hires an entertainer, private entertainer on a Sunday night? What type of people are
what
they?
I'm saying.
On a Sunday
let the co-host run the show. That's all right. He must be a singer for BAHA MEN or something like that.
Yeah, something like that. He must think he's a lead singer for BAHA MEN.
Yeah, you think he's a lead singer for BAHA MEN. Yeah.
Obviously. Yes. Guys, thank you very much. Great talk. We definitely have to do this again.
Yeah.
Because
thank you for having me.
We didn't cover everything. Nadia, thank you so much for standing and taking the fire. Let's see if both of us get banished tomorrow or something. We might get some letters. But that's the danger of being on the show.
Yeah, half has still not been told. So
we definitely need an episode,
definitely
a second part of this episode here. With a returning guest, definitely.
All right, you guys. Thanks for watching. Have a good night.
Have a good night, everyone.
Salute.
Be safe.
Take care of yourself. Goodbye.